Hello, my name is Dr. Quentin Uack, and I'm here today to teach all of you about the abdominal aorta, the abdominal aortic aneurysm, complications that can arise, and what you should expect if you need treatment. Arteries in the human body, including the abdominal aorta, are comprised of three layers. The innermost layer, shown here in yellow, is the tunica intima. The middle layer, shown in green, is the tunica media. The outermost layer is the tunica adventitia. An aneurysm occurs when one of these layers is damaged. Here we have a model of an abdominal aorta. Note the bulge here, just below the SMA, where damage has occurred to one of the layers and blood pressure is slowly pushing the vessel outward, stretching it. If this continues, it could cause some serious health problems as blood could begin to leak into the thoracic cavity.
There are three main types of aneurysm: saccular, fusiform, and pseudo. A saccular aneurysm emerges from one side of the blood vessel and resembles a sac, hence the name. A fusiform aneurysm emerges from both sides in a wide bulge. A pseudoaneurysm occurs when one of the inner layers of the artery becomes damaged, but the outer layers do not, resulting in a collection of blood in between the layers of the artery. While anyone is at risk for an abdominal aortic aneurysm, your risk factor is increased if you are over the age of 60, if you are a male, if you smoke, if you have a history of heart disease or peripheral arterial disease, if you have hyperlipidemia, hypertension, or a family history of AAA. For smaller aneurysms, treatment may not be necessary, as they may close up on their own. Doctors will measure it and monitor closely to ensure that it's not expanding. However, if treatment is necessary, there are a few options. For a traditional open surgical repair, the surgeon will make an incision into the abdominal wall, remove the distended portion of the aorta, and replace it with a fabric graft shaped like a pair of pants. The waistline of the pants will be sewn into the aorta above the level of the aneurysm, and the cuffs of the pant legs will be sewn into the common iliac arteries. A hospital stay of between 5 and 10 days is usually required. Recovery and return to a normal routine take 1 to 2 months, typically. The less invasive option would be endovascular aneurysm repair, or EVAR. It involves a small incision in the groin, where they insert the stent graft through a catheter placed in the femoral artery. The stent graft is expanded inside the aorta and held in place by metallic hooks or struts rather than stitches. The blood flows through the stent graft rather than the aneurysm, stopping further damage. Hospital stay for this is generally 1 or 2 days, and the majority of patients go back to normal activities within a week. Once the endograft has been placed, there is a need for a long-term surveillance to ensure that the graft remains in the correct position, that flow through the graft is normal, and that the aneurysm is not continuing to expand. The schedule for this varies, but generally tests are ordered at 3, 6, and 12 months after the endograft is placed, and then once a year after that. For more information, feel free to contact us at any of the following numbers or websites. Thank you for watching.